The Northern Adelaide Local Health Network, or NALHN as is commonly known, has a great tradition of being a can-do organisation, of being innovative, high-performing and focused on meeting the needs of our patients and community. Over the last few years, we've seen significant growth in our services to meet the needs of our growing population. With this, we need a roadmap, a plan to meet our future needs.
I'm very pleased to provide you with this video launch of two important NALHN initiatives recently completed. These are the Northern Adelaide Local Health Network Strategic Plan for the period 2020 through to 2025 and the accompanying consumer and community engagement strategy for the same period.
Our strategic plan sets out our vision and our values as an organisation and our 6 key imperatives to take us forward over the next 5 years. Our aim is to become a high-performing, exemplar health organisation, driven by population health needs and excellence in leadership and clinical care. We are in a great position to recognise our achievements and build on our successes to date. This is an exciting time for our staff and our community as we see a further $150 million invested in our hospital sites as part of Modbury and Lyell McEwin redevelopments.
In late 2019, the draft plan was released for wider community consultation. I'm pleased to say the feedback was positive and supportive of our vision, values, and the strategic imperatives. Through that consultation process, we have listened and heard your views on the strategic directions for NALHN, and we're pleased to note the support for a clear vision and well-defined goals for NALHN services over the next 5 years and beyond.
Together as an organisation, we will continue to develop contemporary, sustainable services, strengthen our culture to be great places to work, support our workforce and expand our partnerships within the community involving local councils, government, universities, non-government organisations, general practitioners and primary health networks and the private sector. We will embrace technology and innovation and ensure we include our consumers and our community in the design and the heart of our health services. What was really important throughout the planning process was that we really wanted to better understand what does high quality care look like and feel like. Care that is underpinned by the latest evidence and shaped by clinical excellence and patient feedback. It's all about being people-centred and delivering care that contributes to our community, having the best possible health and wellbeing throughout their life. When we are working with people, we need to keep in mind what's important to them, not just what's important to the system. Delivering better health and wellbeing outcomes is why we're all here and why people work in healthcare. Because we care about people, we care about each other and our patients and our community. We also have a renewed focus on supporting and developing our people across the organisation and strengthening our positive culture. Everyone has a story, everyone matters, everyone contributes and everyone grows. I am incredibly proud to be the CEO of NALHN and work with such exceptional staff who make the biggest difference to the quality of care we deliver. Our plan sets out how we will continue to support a positive workplace, build on our workforce for the future so that we can meet the needs of our community and become an employer of choice.
So in summary, the strategic plan is the key instrument to guide the governance and the actions of NALHN towards our goal of optimal health and wellbeing throughout the life of all residents of our northern community. Let me now move on to the consumer and community engagement strategy. I'm very pleased to also be releasing that strategy. The board believes it is critical for NALHN to have very effective two-way linkages into the community and with our consumers. We look forward to continuing to work with the Consumer Advisory Council and to further build our relationships with our consumers as we go about implementing the engagement strategy.
Thank you for your input and support throughout the development of the strategic planning process. This is an exciting time for all of us and I'm delighted to be part of NALHN and for the future of the Northern Adelaide Local Health Network.